Hygiene. Here are 7 important points to remember. Clean hands. Always wash your hands thoroughly before handling your newborn. Keep the diaper area clean and dry. Change diapers or nappies often to prevent diaper rash. Keep the umbilical cord stump clean and dry. Follow your healthcare provider's instructions for caring for the stump. Cleaning your baby's face. Clean your newborn's face and eyes daily with a clean, wet cloth. Cleaning your baby's mouth. Gently clean your newborn's mouth and tongue after feeding with a wet cloth or gauze pad. Bathing. Bathe your newborn 2 to 3 times a week in lukewarm water using a mild baby wash. Lotions and powders. Avoid using lotions, perfumes, or powders on your newborn's skin, as these often contain perfumes and may be too harsh for your baby's skin. Only use a lotion when the baby has a dry skin.